Hello, everybody, and good morning. Thank you for being with us this morning. Today, we are doing the Ocean Monmouth Health Alliance Quarter 2 meeting, and I thank you for joining us for that. There will be an opportunity and discussion at the end for each of our partners to give an update, and I'll start us off by giving us some OMHA updates. I am Jenna Sistad, project manager for the Ocean Monmouth Health Alliance, and I'm trying to figure out how I can share my screen with you all. How about now? Can y'all see it?
Yes.
Yes.
Thank you so much. So here we are just doing some welcome and introductions. Thank you to those who have introduced yourselves verbally and also in the chat box. It's always nice to know who's with us so we can make these valuable connections and partnerships in the community. A few updates on things that we've been working on our end. The first thing is our community health worker. We have extended the offer to a lovely individual who has great experience. And we are excited. Right now, she is in South Carolina finishing up school, and we will be welcoming her in December. I'm a little weary to share much more information until she actually starts. So more information to come on that. But this is a part-time position. It will be 15 hours a week with the coalition, and we will be sharing this position with the SEED team. So part us and part SEED, but really working together to get our cancer screening numbers up and education and outreach in the community happening in both counties, Monmouth and Ocean. So we're excited for that. A couple things that we worked on over the past quarter was our vaccines and veggies event. That was an event that we did with SEED, with the Freehold Family Health Center, and Neighborhood Connections to Health. This was an event where we offered lots of different health screenings, A1Cs, blood pressures. The SEED team was there promoting screenings and signing people up for mammos. We also had Central State and the health department there doing vaccines with us. So it was great. And then there was that veggie component. We had a line, a produce line, so that people could leave with some healthy options as well. You finished cancer treatment. Now what was something that the Elixir Fund and the coalition did alongside Centrostate back in August. This was really designed to be a conversation between primary care, oncology, and patient. So it was much like a roundtable discussion where we had survivors in the room, medical professionals. We had two wonderful docs from both primary and oncology with us there, Dr. Pedowitz and Dr. Coate. It was a comprehensive discussion where Meg Macquarie, who I think is here, and I were able to facilitate discussion between the docs and the patients, the survivors. And we had a really comprehensive discussion about the importance of just keeping the survivors and the patients involved in this communication that sometimes we get lost in translation, literally and figuratively. And then really everyone's not on the same page. And so we talked about the importance of possibly implementing what we're calling a transition planning meeting at the end of the cancer treatments life cycle, if you will. So when they're done doing treatment, what will life look like for them afterwards? And really having maybe a transition planning meeting with primary care and oncology will be a benefit. So we're doing more things like this. Central State was much like our guinea pig partner, and it was wonderful, well received. So we are now having conversations with Memorial Sloan Kettering docs about replicating something similar with them and their team. So we're excited. If you belong to a hospital system and you would like to do more things like this with us, Meg and I are open to the conversation, and we can have a discussion offline about what it could look like if you're interested in doing something like that with your teams. Again, this would be bringing primary care, oncology teams, and the community together, cancer patients and survivors. That's that. Then we did Wellness Rocks in October. That was in Lakewood. We partnered with the Lakewood Police and Fire Departments. It was an exciting event because they were also promoting Fire Prevention Month, which I did not know was in October. So an exciting opportunity. Again, Seed was a partner there with us. Also, the County Councils for Young Children was there, promoting early childhood development screenings. So it was a nice event. And again, much like vaccines and veggies, we did a lot of health screenings on site, vaccines, and a lot of people left with different things that they didn't have before, vaccines and health screenings. Just yesterday, we did the Ask, Advise, Refer training, and that was with the cooperative down south. And it was a wonderful training. We had 18 people there, and everybody left with resources on how to have a discussion with the families that we work with about quitting smoking and navigating to smoking cessation, tobacco cessation programs. So thank you to everybody who's done things with us in the previous quarter. We continue to have events like this on our calendar for the new year. And so, thank you to those who have committed to doing things with us up and coming. And if you are somebody who would like to coordinate and collaborate, please reach out because we would love to do something together. Moving into, oh, that should say, yeah, no, that's right. Upcoming events in 2024. So on the 13th of November in Freehold, we have our turkey smokeout event. This is going to be, let me see if I could pull up the flyer for you all. I think that should do it. This is an event that's going to highlight lung cancer awareness since November is Lung Cancer Awareness Prevention Month, and neighborhood connections to health, as well as the Seed team is going to be with us on site. We're thanking Fulfill in advance for the 100 turkeys that they're going to be providing to us. And then we'll also have some of our other community partners like Central State and some other insurance providers on site providing information about lung cancer screening and access to those services as well. So we'll be giving out turkeys, some of the fixins, some of the sides for Thanksgiving meal, and also promoting lung screenings as well. So if you are interested in being on site and tabling at that event, we welcome you. It would be a bring your own table and chairs kind of event. This is not one of our bigger events where we provide like tents and tables and chairs and things like that, but we would welcome you to be on site if you'd like to share your agency information. Going back to the agenda and going to bring us back to the next set of 2024 events. Okay, so we are continuing to do our Health to Hold on a monthly basis. The next one will be on November 27th. And again, lung cancer awareness. So we are thanking Tobacco Free for Healthy NJ for being our featured speaker. And we will attempt and aim to do this whole series again in 2025. So I know I've reached out to some of you and I've asked if you would like to be a presenter and work with us on a specific month. Some of you are already signed on to do so, so thank you very much. And then later, maybe either later this week or early next week, I'll be sending out an email to the rest of the coalition asking for those additional dates that we have not yet had somebody sign on for to see if there's any interest. So be on the lookout for that. Could be an opportunity for you to share what your organization is doing and highlight a health awareness month. And then finally, we have our 2025 quarterly meeting schedule. So this meeting for 2025, we have outlined our 4 dates. It's February 5th, May 7th, August 6th, and November 5th. From all of those will be virtual from 10:30 to 12 p.m., just like we're doing today. So please, I think I put our save the dates in the email reminder that I sent out yesterday, but I'll also include it in the minutes so that you have it. But here's just a quick snapshot of, what we're doing and when our meetings will be. And here's the links and the meeting IDs and passcodes so that you can log into the Zoom. So again, you have those in your inbox from yesterday's reminder, and you'll also get them after today's meeting is over. So those were my updates. And again, thank you for the wonderful partnerships that have happened all year long. I can't believe this is our last quarterly meeting in 2024. It's wild to think that. But if anybody has any questions or anything to add about any of the updates that I gave that maybe I forgot, please feel free to take yourself off mute now and ask any question or give any other input. Okay. Oh, I'm seeing some things come through the chat, so let me check that before I move to the next agenda item. Okay. All right, it's just more people introducing themselves. Thank you everyone for being here. Welcome, welcome. I will stop sharing right now so that I can start to see everybody because now would be the part in the agenda where I hear from all of you. And we welcome you to It's a Manageable Group today. If you want to take yourself off mute, I would love to hear any updates from your organization, any services that you're offering, new programs, anything you want to promote. So feel free. Anybody can
Hi,
start.
Jenna. Jane Walling from
Hi,
the Ocean
Jane.
County Office. Hi. I just wanted to mention I'm from the Ocean County Office of Senior Services. We're at 1027 Hooper Avenue in Toms River. I put our address and our phone number in the chat. Right now, I just wanted to make everybody aware that open enrollment is going on for Medicare. And this is a time for anybody who has Medicare, especially Medicare Part D, the drug plan, where they can look at the plans and compare costs and savings and choose a different plan for next year. This open enrollment period ends December 7th. So, and it's coming up quickly. We make appointments. Our appointments are filling up. If any senior or anybody younger who's disabled and on Medicare needs to consult with somebody about this topic, please refer them to call our office and we will assist them with that. And that's what I have. Thank you.
Oh, thank you so much for mentioning that, Jane. I appreciate that. And I ran into a colleague of yours at the CHIP meeting last week. We were discussing you a little bit and how wonderful you are.
Oh, thank you.
All right, thanks, Jane. Anybody else have another update that they would like to share?
Hi, good morning, everyone. This is Mariela Flores. I actually work now for Community Affairs and Resource Center, specifically with the LED program. I'm the director of the LED Health Education and Community Outreach. I've known Jenna and the whole coalition for a while. But I just wanted to give an update with we have the lead remediation and abatement program, and we are currently have been given the additional county, which is Ocean County. So just any homeowner or tenant that would like a home visit, please refer them to us. We do an actual free evaluation of their home to check to see if they have lead. There is an income guideline, and I'll be sending some information to Jenna for her to share. We have Monmouth County, Ocean County, Middlesex County, and Atlantic County. And basically, we do a home visit to check if they have lead. If they do have lead, then we're able to provide them with some education. If they qualify to have the lead removed, it doesn't have to be a positive case like or a child living in the home. We do a risk assessment and to see if they qualify, then they can have the lead removed from their home completely free. This is a grant through the DCA. Before kind of program has been going on for a while, yet in the past it had to be a child present. There had to be other guidelines. Now it really just lead needs to be present. And again, there is an income verification. It can be tenant application or homeowner application. And like I said, I'll be sharing some information. And we also do lead education, and that can be in Spanish and in English. Thank you. Any questions, please? I'm going to put my information on the chat. And like I said, I'll be sharing some information with Jenna.
Excellent. Thank you, Mariella. And I'll just piggyback on that and say years ago in our first home, we did have lead, and the CARC team came out. They educated us back in the day. Carmen was there. She was telling me all about the risks and, even to how much it affects our dog. And they remediated, they used all their resources. It was a very seamless process. Everybody was wonderful. So if you have families that are really exposed to lead in their home, please, don't hesitate to reach out to CARC.
Thank you, Jenna. Thank you for sharing that. Because sometimes we don't think that it happens. Unfortunately, there's still a concept that it's happening in certain aspects of our towns, but it really can be in many homes. So we definitely need to be aware of that.
Absolutely, absolutely. Thank you. Carmen, I see that you're here and you're also with CARC. Do you want to give any updates from your end as well so that we have all of CARC covered? Oh, can't hear you, Carmen. I see your mouth moving, but I can't hear you.
Oh, I think her mic is probably a little bit off.
No, still not. All right, while you troubleshoot that, we'll go to the next person, so then we'll come back to you.
Oh, and I'm sorry, actually, I apologize. I
Yeah.
forget. So please just also remember we do have an office in Freehold, the satellite office in Freehold in Lakewood. We also have other great programs, and I'm in my lead head, so I'm just like narrow, but we have energy assistance programs. We have a weatherization program just specifically in Monmouth County. The energy assistance support, we have it in Monmouth, Ocean, Atlantic, and Middlesex as well. Um, we have our DV advocacy program, and that is for anyone going through any kind of DV situation or sexual assault. We also provide services for the moms. We have ESL classes, computer classes in Asbury Park location. So lots and lots and lots of great services. Again, I'll be happy to provide any information of that if you want to reach out to me, and I'll put my information is in the chat.
Thanks, Mariella. And everything that they do is in English and in Spanish, which is so
Yes.
necessary. So, thank
Yeah.
you. Okay, I'm gonna wonder, I know at one point Raven was here, but Angelica, Tiffany, any updates from Seed that you would like us to know about?
No, I don't have any updates as of now. I'm not sure if Raven has anything she wants to add or anything.
Okay. Okay. All right. I don't hear her coming off mute. I don't see anything in the chat either. So, okay. Anybody else have an update that they would like to share?
If I could, Jenna.
Hey, Pete. Yep.
Hey, how are you?
Great.
I just wanted to thank everybody. We had our largest partnership for Healthier Ocean County meeting last week. I believe it was 59 people from every discipline. We have easily the largest coalition out of all 21 counties, and that's very little because of me, but mostly because of you and all of our partners. So we're constantly trying to expand the footprint of public health, and we just appreciate the partnership. And you've been wonderful with the Health Alliance, Jenna. So professionally, thank you to you and your colleagues, and onward and upward. Thank you again.
Thanks, Pete. And would you do me a favor that I know they sent out the survey that you were encouraging all Ocean County folks to take. If you have that handy, would you mind putting it in the chat box so that everybody here has the opportunity to take that?
I'll give that a shot. We have had a power outage, and now we're back online. So what I'll do is, if I can't do it, I'll email it to you.
Okay, sounds good. Yep. And what this is Pete and his team are going through a very extensive community health improvement plan process. And we were involved in one of the interviews, and we were also involved in, having the opportunity to take the survey to provide this valuable feedback that they need so desperately to create the new plan. So if anybody is, doing business, working, living in Ocean County, this would be a good time to provide your input.
Friendly man, like.
Okay. All right.
Perfect.
Thanks, Pete. Anybody else? Another update? Okay. I see your request for the survey providing. Yes, I will look into that, and I'll put it definitely in the meeting minutes when I send those out.
Jenna, can I just share a little bit?
Hi, Kathy. Yes, of course. That's what I would hope everybody would do.
Hi, everyone. I'm Kathy Nugent. I'm the senior director of regional programs for cancer care. And I probably mentioned this last meeting, but if not, I just want to give a shout out again. um, in May 30th through the weekend of May 30th to Sunday, Friday, May 30th to Sunday, June 1st. We will have our Healing Hearts Family Bereavement Camp again. We do this every year. I believe this is either our 16th or 17th year. It is a free camp for families who have lost a loved one to cancer within a 2-year period. The ticket to come would be that it has to be a child involved. And this is a camp that the whole family is invited to. It can be a grandparent that has died, could be a parent, could be a sibling, aunt, uncle, doesn't matter, as long as there's a family and there's a child that will be attending. Last year, we had 22 families. We're hoping to have another 22 families come again this year. It is in Poconos, and I can send Jenna over the flyer. We've got that. We're starting to recruit. We already have, I believe, 10 families that are interested. So, and this is a national program, so it's not just for New Jersey. We are pulling families from all over the country. Last year, we had a family come from Seattle. The year before, we had a family come from Texas. So it is a totally free weekend. The only thing that they have to pay for is to get there. We don't have funds for transportation. But it is a weekend of really, the kids really get a lot out of this because a lot of kids don't know other children who may have lost a dad or a mom, grandma, grandpa, brother, sister, and they get to make new friends. And it's just a beautiful, beautiful weekend. So if you have anybody that you've worked with within the past 2 years that has died of cancer, please let us know. We would love to get them signed up for our camp. And then the only other thing I wanted to share was that Cancer Care's New Jersey office, which happens to be in Paramus, I know it's far for you guys, for most of you, but we are having an open house for professionals January 22nd in our Paramus office, just to get the word out about our programs and have the opportunity to meet our staff and to learn more about others in the community, other organizations and programs. So I will also send that over to Jenna at the end of the meeting, and she can share that with you all. So
Thank you
thank you.
for that. I was going to ask about, will there be like a virtual option for your meet and greet? I know open houses are usually in person, but
Yeah, no, not this time. It's going to be in person. We really want to start getting folks into the office. And, actually I have some people coming from the Princeton area that are coming up. So, it's from 5 to 7. It's just a nice opportunity to meet some of the folks that we've worked with through the years, or that we want to learn to work with them. So thank you.
absolutely. Thank you, Kathy. Anybody else?
Hi, Jenna. It's Susie.
Hey, Susie, what's going on over at Parker?
I just wanted to let those who may not know, we completed our construction, our renovation and expansion. Yay.
Yay, 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 yay.
And if anybody wants to come by, oh, thanks, Jenna. Anybody who wants to come by who wasn't at the ribbon cutting and open house, you're all invited to come by. I put my email in the chat. Happy to give you a tour. We've added exam rooms. We now have 8 exam rooms. We have community spaces. We have consultation areas. So happy to have all of you, anybody who would like, come by and see the new space. And for those of you who don't know Parker, we're in Red Bank, 211 Shrewsbury Avenue. And we provide free healthcare to uninsured residents in Monmouth County, and it's totally free from ages 3 and up. And we work with Seed, we work with Jenna's group, fabulous, fabulous partnerships. So happy to have anybody come by. And we're now offering physical therapy on site, so that's nice. Yeah, a nice
That's
addition.
awesome.
Yeah.
Yeah, and I still I scratch my head going, how does Susie secure funds to do all of this and do it for free? And so be thinking of these types of things if you have access to funds, or you're coming from an organization that looks to give out funds, be thinking of of places like Parker because they have so many comprehensive services for families. And who could ask for anything better than for something at no cost to somebody who needs medical care?
Thank you, Jenna. Thank you so much. Nice to see everybody.
Thank you, Susie. Anybody else that's here that would like to give an update? Oh, I think I just lost power too. Ocean County, what's going on here, people? Okay. Terry, I saw you take yourself off mute. Are you there?
Yes, I am. Good morning, everyone. Terry Harrison. I'm with Oncology Outreach for Hackensack Meridian Health, and we do a lot of education. And I just want to mention for Lung Cancer Awareness Month in November, we have our Fresh Start smoking cessation class, and it's at Ocean Medical Center. It starts on the 12th. Also, we have Stop Smoking with Hypnosis, which is a virtual session that's done, and that's November 13th. And we do have a webinar from COPD to lung cancer, the most advanced care available in New Jersey, and that'll be November 19th at 6 to 7 p.m. And in the chat, I'm just going to put our website where you can see these events if you'd like to have more information. And that's all I have. Thank you, though.
Thank you, Terry, for giving us that recap. And also thank you for sending me stuff this morning. Some of you I reached out to this morning asking for lung cancer specific infographics, education, events, programs that you're scheduling, because on Friday this week, the Department of Health has asked us to attend their workplace wellness event, all related to their employees and employee health. And they're trying to drive their employees all over the state to different lung cancer screening opportunities. And so they asked each of our coalitions to be present and provide things that our hospital partners, our insurance company partners, our health department partners are offering. So if there's something that you would like promoted that you're doing in either Monmouth or Ocean County related to lung cancer awareness and or screening services, please feel free to email those to me so that I can bring them with me on Friday and promote them. And thank you, Terry. You were one of the first ones to respond. All righty. Anybody else that's here that would like to give an update? Carmen, are any shot your mic came back? No. Okay. Okay, so she's not able to get back via her microphone, but yeah, so Carmen Quigley and Mariella Flores, who you heard from before, both work together at CARC. And so all of the things that Mariella offered and gave you information on, Carmen could help as well. So if you need anything about weatherization, utility assistance, domestic violence, lead remediation, all of those things are good things for Carmen and Mariella. I hope I did you justice, Carmen. Okay. All right, I'm gonna do a final call. Is there anybody else that would like to have the floor and give an update? Okay, so I'm gonna put one last thing in the chat. I'm gonna direct everybody's attention to the chat box if you can. There are two things there. The first thing is the experience survey. So for today's meeting, to any other event you've done with us in the community, please provide some experience feedback. Let us know how we're doing. Are there things that we need to improve with? Other programmings that you'd like to see that we haven't offered yet? All of these things would be good things to put in your feedback survey. And then the other thing that's there is a link to our Facebook page. It's me monitoring the Facebook page, so I understand I'm probably missing a ton of stuff. But if there are things from your organization you would like me to put up on our Facebook page, that would be a great platform. You know, it's not just for the things we're doing, but for the things that all of you are doing. So like Kathy, please, your healing hearts, I would love to put that on our Facebook page. You know, Terry, some of the lung stuff that you sent me this morning, I'll be putting up that as well. So Please take a look at our Facebook, like, follow, and share some things that you would like for me to post there. So those are the two links. I'm going to leave them with you for just another minute or so and offer the opportunity for anybody else that would like to give an update, the opportunity to do so before we conclude today. Okay. All right. Hearing none, seeing none. I think this concludes our meeting today. We did not have a presenter, and that's okay. Next time, I'm hopeful that we'll hear from Dan Pearson. He had submitted a poster for a conference that he just went to out west, and Ocean Monmouth Health Alliance was a partner in that poster. So I'm eager to see and hear from Dan how it went when he presented it, and hopefully we could do that at the February meeting. So thank you, everybody. You're getting a bunch of time back in your day today, and happy Wednesday. Talk to you all soon.
Thank you,
Bye-bye.
Jenna. Take care.
Bye-bye.
Thank
Bye,
you.
Jenna. Thank you.
Thank you.